Hello people, namaste, welcome back to my channel. In this video I will discuss about the continuation of mechanical asphyxiants. Okay, so I will discuss about the suffocation. In this video I will discuss about the suffocation. Define suffocation. What is the definition of suffocation? Suffocation means exclusion of air from lungs without neck compression. No neck compression will be present in the suffocation. Air will be excluded. Exclusion of air from lungs without compression of neck is called suffocation. Okay, this is the definition. Okay, in neck suffocation has types like smoothing and gagging. These are the short answers for investigation. Sometimes they will discuss the smoothing, discuss the gagging and choking also. And traumatic asphyxia is very important. Traumatic asphyxia. Another is barking and overlying are also present. Barking and overlying. These are all comes under the suffocation. Suffocation definition is exclusion of air from lungs without compression of neck. First type is smoothing. Smoothing means this is simultaneously closure of both nostrils and mouth manually by hand. Closure of both nostrils and mouth by hand, by manually by hand. This is the smoothing can be accidental. See, accidental smoothing is generally neonates who's born with intact sac. Example, neonatal born with intact sac. Neonatal born with intact sac. First accidental. Next, infants covered by heavy blankets. Covered by heavy blankets or many bed sheets. All these blankets or bed sheets, anything. And these are the infants. If adults like a drunken state fall into the mud or sand, mud piles or fall on them in drunk state. So these are the accidental of smoothing. Both nose and generally nose and mouth are what is that? Nose and mouth both are closed closed manually by hand. Accidentally generally by the infants having a intact sac. Infants covered by heavy bed sheets or adults who are in drunken state, when they fall into the mud or sand, it leads to smoothing. And homicidal is intentionally they are smoothing with pillow by hands. This is common. Intentionally they are doing. Then we have some signs like perioral injuries. These are important. Perioral injuries in smoothing and lip injuries can be seen in this homicidal smoothing. Homicidal smoothing has perioral injuries and lip injuries. Suicide is it is very rare. It is unlikely. Suicide is not present. Accidental and homicide is present. Homicide has important signs like they have perioral injuries and lip injuries in present in smoothing. So this is a smoothing. I discussed the first suffocation definition, exclusion of air from lungs without neck compression. Next, smoothing, I discussed the definition like closing of mouth and nostrils manually by the hand. It is accidental and homicidal and suicidal. Next, about gagging, thrusting of cloths or pad by putting of cloths or pad like cloth into the mouth leads to obstruction of naso or any pharynx. Obstruction of pharynx leads to asphyxia. By putting cloth in the mouth, it leads to obstruction of pharynx, asphyxia, as a asphyxial gag in the mouth. It leads to asphyxial gag in the mouth. Sometimes they're putting a cloth, because of this leads to asphyxial gag in the mouth. How the appearance, postmortem appearance, externally what we can see, internally there's something gag in the mouth. Externally gag in the mouth is present, it comes under gagging. Next, congestion and abrasions also present around the mouth. Abrasions, contusions also. mouth and oral cavity, total oral cavity. Because of gagging, thrusting of cloth or any pad, it leads to obstruction of nasopharynx and oropharynx, leads to asphyxial gag in the mouth. So externally you can see some gag in the mouth, and contusions, abrasions, and what is that, congestion can be seen around the mouth and oral cavity. So internally all clinical signs are positive, asphyxial signs all can be seen in this gagging condition. So this is internally. Homicidal, it is the most common. Accidental, it is rarely rarely something toys may slip back and block the infant's no, pharynx, all this accidentally. But suicidal is not present, it is not possible, suicide is not possible. So I discussed about the smoothering. In smoothering it is accidental is present. Homicide is perioral and pelvic injuries. Accidentally write some examples. For gagging, something cloth gag is present in the mouth, so you can define externally, internally what are present. It is a homicidal, it is most common, and accidental is rare, and suicide is not possible of with gagging. Next comes the choking is a short answer question. Okay, generally choking and traumatic asphyxia are important. Choking, obstruction of airway, accidental, because of it, choking is an accidental obstruction of airway. Accidental obstruction of airway leads to respiratory distress and asphyxia of the healthy person due to foreign body. Because of accidental obstruction of airway, respiratory distress will occur. Respiratory distress, and healthy person undergoes asphyxia due to some foreign body. What is that foreign body? Because of bolus or any coin or any fish bone like chicken bone, any bone. This is a sudden obstruction, accidental obstruction leads to respiratory distress. It leads to healthy person having respiratory blockage because of due to some foreign body like a fish bone and bolus and coin. When what we then treatment is manicure. Helmich maneuvers or not maneuver. Helmich maneuver means it just put a pressure on the epigastrium. Pressure over epigastrium. Pressure over epigastrium is Helmich maneuver. This is the treatment. Okay. Generally, see where the more chances. See, when we take this is the treatment for choking. Okay, put a pressure on epigastrium. See, I will give one example. Like obese person is there, no? When the obese person who is intoxicated or drugged, they have a sudden death while eating. Sometimes sudden death while eating. Why? Why sudden death? Because of intoxication and drug, they have depressed gag reflex. Depressed gag reflex. Because of depressed gag reflex, it leads to death because of choking. Sometimes the obese persons who are intoxicated and drugged are while eating they undergoes death because of depressed gag reflex. So based on this they are divided into two syndromes like cave coronary syndrome. This is important one, very very important. Cave coronary syndrome, and Creech coronary. Creech coronary and cave coronary syndrome. Cave coronary syndrome, Creech coronary. Cave coronary is in an elderly and intoxicated person. Big ones, elderly ones and intoxicated ones. Cave coronary. Creech coronary is pediatric, small babies. Pediatric population, Creech coronary, cave coronary syndrome. This cave coronary syndrome is coined by Hogan. Coined by Hogan. What is cave coronary, Creech coronary? Because of cave coronary and Creech coronary syndrome, decreased gag reflex. Gag reflex is not decreased. Then foreign body is present. But gag reflex is decreased. Because of this airway obstruction and no respiratory distress will occur. Airway obstruction will occur. Because of airway obstruction, vagal inhibition of heart. Vagal nerve stimulation occurs. Because of this vagal inhibition of heart occurs, it leads to sudden death. But we are thinking that they are died because of myocardial infraction. See, obese people are see, I discuss obese people like intoxicated, they are while eating suddenly death. Why they suddenly death? Because of decreased gag reflex. That is called coronary. This is called Creech coronary and cave coronary syndrome. In adult people intoxicated predisposed for, because of decreased gag reflex, there will be obstruction of airways and respiratory distress will occur. Vagus nerve stimulated. Vagus nerve stimulation, it leads to vagus inhibition of heart and sudden death. When we it with apparent death, cause of death is myocardial infarction. This is the choking. Choking is a short answer question. Next, in postmortem examination, presence of foreign bodies in the larynx, foreign body in larynx, and clinical signs of asphyxia. Asphyxial signs are also present in postmortem appearance. Okay. Okay. Next, traumatic asphyxia. It is also short answer question. Traumatic asphyxia. Heavy weight upon the chest, like stamped and collapse of building something. Heavy weight on chest. What is heavy weight? Like stamped in and some collapse of building on their body. Heavy weight, like that. Heavy weight. Because of the heavy weight leads to mechanical fixation of chest. Mechanical fixation of chest. Mechanical fixation of chest leads to lung expansion restricted. Mechanical restriction of lung expansion. Restriction of lung expansion leads to asphyxia. Is the because of the heavy weight or leads to mechanical fixation of chest. Another point is, this is important. Mosque ecchymotic. What is mosque ecchymotic? Above the level of obstruction. See, this is the person here, that heavy weight falls on the body. So mosque ecchymotic means above the level of obstruction, completely cyanosis. This undergoes completely cyanosis. Above the level of obstruction, completely cyanosis. It leads to blockage of venous return from the upper body part. Cyanosis will occur and venous return also blocked. Venous return also blocked. It leads to presence of petechial hemorrhages are present, petechiae are present, demarcating line also present. See, demarcating cyanosis will occur, no demarcating line is present, petechiae present. Next, subconjunctival hemorrhage, all these are present. This is the traumatic asphyxia. Next, other asphyxias, postural or positional asphyxia. This is due to restriction of lung expansion due to abnormal position. Abnormal position of body. Two types of position, like jackknife position, jackknife, and inverted crucifixion, inverted crucifixion. Here in jackknife, compression of organs like lungs. Here, due to compression of lungs by internal organs, because of inverted crucifixion position, because of internal organs compresses the lungs. Okay. Here, jackknife, abnormal organs fixes same, both are same. Lungs can be compressed by other organs. This is postural or positional asphyxia. So, traumatic asphyxia, positional asphyxia. Next, barking and overlying are also present. Barking means some victim is here victim is present. Some person is sit on the victim. And another person is there, he is closing the nose and nostrils. This is called barking. This is homicidal. Barking is homicidal. Next, overlying. Overlying means here some small baby is there and his father or mother sometimes accidentally they overlie on the baby. It leads to death of the baby. Accident. It is accidental smoothing and traumatic asphyxia. So I will summarize it carefully. You should listen. This is very easy. Suffocation, exclusion of air from the lungs without neck compression. First point. First one is smoothing. Smoothing means simultaneously closure of mouth and nostrils by manual hands. It is accidental homicidal. Accidental is in infants, two type, covering with intact sac covered by the blankets, and drunken persons who are fallen into the piles of mud and sand. Next, homicidal, it is the most common. Smoothing is most common. You can see perioral injuries and lip injuries. Suicidal is unlikely. Next, gagging. Gagging is throating of thrusting of cloth because of this obstruction of nasopharynx, oropharynx, asphyxial gag in the mouth. Postmortem appearance externally, internally. What is external, internal? Presence of gag. You can see some gag in the mouth. Mouth has And next we can see some confusions, abrasions, and congestion at the mouth and oral cavity externally. Internally we can see say asphyxial signs are all asphyxial signs are positive. Homicidal it is rare, accident it is most common, suicide it is rare, accidental also common, sometimes rarely. Next, choking is accidental obstruction. Accidental obstruction because of some foreign body in the mouth leads to respiratory distress and leads to death. Leads to death. The foreign body, what is foreign body? Football is coin and fish. What is the treatment like? Helmich manure, pressure water, epigastomy. For obese person like a drunkard and he's drugged sometimes while eating, he is dead. Why he is dead? Because he has two syndromes like cave coronary syndrome and Cagé syndrome. Cave coronary syndrome comes under elderly person, intoxicated, pediatric population. In that people gag reflex decreased, foreign body is present. Because of the respiratory obstruction will occur, vagal nerve stimulation will occur. Because of vagus nerve stimulation, vagal inhibition of at sudden death. Okay, we are thinking apparent cause of death due to myocardial infarction. This is the choking. Next one is we can postmortem appearance. We can see foreign bodies and signs of clinical asphyxia, traumatic asphyxia. Heavy weight upon the chest like stamped and collapse of building on mechanical fixation of chest will occur. Lung expansion, restricted asphyxia. And their point is mostly ecchymotic. Because of this, some weight on the body, upper part becomes sinuosed and blockage of venous cavity. So we can see demarcation line and subconjunctival hemorrhage and petechiae are formed. Next, postural and positional hypoxia. Because of abdominal position, it leads to restriction of lung expansion. It is two types of position like jackknife and inverted cruciform. Because of other organs, lung compression will occur. Okay. Next, barking. Barking is accused. Some accused sits on the chest of the victim and closes the mouth and nostrils. It is homicidal procedure, smoothing and traumatic asphyxia. Okay. Next, overlaying. Large person shares the bed with small baby. This mechanism is accidental smoothing and traumatic asphyxia. This is the video of suffocation. Okay. Thank you. Please subscribe my channel. Please support us. Thank you.